Welcome to the Intensive Care Unit at Royal Derby Hospital. This video will talk you through our unit to help orientate yourself before you start your new rotation. The ICU is located in the second floor of the main building, just before you get to the main theatres. As you enter the unit, the lobby will have the reception desk to your left. The main unit will be straight ahead of you, and to your right will have a corridor that will take you to the seminar room. We will first go through to the main unit. You will need swipe access to enter through the second door. Immediately to your right, you will find the female and male changing rooms. Codes to these will be provided to you at induction. You will also find the oddest office to your right. You are able to use the computers if they are not occupied, making sure to leave the area clean and tidy once you finish. Further along the corridor, you will find the on-call rest facilities to your left. There are 2 rooms on the unit itself. You will find adequate facilities for you to have a rest overnight, including en-suite facilities. Please keep this area clean and tidy once you finish. As you continue down the corridor, to your right will be the coffee room. There are fridge and microwave facilities and an area for you to sit down for your breaks. There is a coffee fund which you can contribute towards if you would like to use the amenities available. Details will be provided to you at induction. Go through the double doors along the main corridor, and on your right you will find the room with the blood gas analyzer. The blood culture packs are also kept here along with the pod to send samples to the labs. Just before you enter the main unit, you will find on your left the transfer equipment. The inter and intra-hospital transfer equipment can all be found here, including the transfer trolley. As you enter the main unit, to your left you will see the entrance to theatres. Further to your left there will be storage facilities where you will find most of the additional equipment you may need. You will now be entering the main unit. You will find this to your right, and it is split into 2 sides. Side 1 is what you see now, and the beds are arranged from 1 to 11 in a clockwise manner. You will find the nurses' station in the middle of the unit. You are able to use these computers, and most of the ICU paperwork can also be found here. There will be a whiteboard with the patients and their dependencies to your left. At the side of the nurses' station, you will find the lines trolleys and machines for ultrasound and echocardiography. Please replace them here once you have finished. You will also find the cardiac arrest trolley and the airway trolley for side 1 on the other side of the nurses' station. As soon as you enter side 1, to your right you will find the clean utility. You will need swipe access to enter this. Equipment for lines and bronchoscopy will be kept here, along with all the medications, including CDs. As you walk along the corridor from side 1, you will find side 2. The beds will be numbered from 12 to 21 in a clockwise manner, with the nurses' station in the middle. The nurses' station on side 2 will also have computers available for use, including a second blood gas analyzer and most of the ICU paperwork. Around the other side of this, you will find the cardiac arrest trolley and the airway trolley for side 2. You can also exit the unit from side 2 by turning right as you enter and walking through the double doors. Coming back to the main entrance of the unit, we will now take a right turn to enter the corridor towards the seminar room. The seminar room is located right at the end of this corridor. This is where the morning and evening handovers take place. Teaching will also be held here either face-to-face or via MS Teams. Heading back along the same corridor towards the main entrance, you will find a doctor's office to your left with 3 computers. Please keep this area clean and tidy once you finish. Lastly, further down the same corridor to your left is the office of the Critical Care Outreach Team. Thank you for watching our short introduction video. We hope you enjoy your time in our ICU at Royal Derby Hospital.